In an episode that defies ethics and shakes the very foundations of the hospital, a racist doctor mercilessly humiliates a nurse, completely unaware that the patient, whose unexpected presence is set to turn the tables, is none other than Snoop Dogg, a twist poised to change everything. The operating room fell silent as Dr. Harrington glared across the surgical table, his eyes cold above his mask. Maya Jenkins, the only black nurse on his team, stood her ground, her voice steady despite the pounding of her heart. "With all due respect, Doctor, the patient's blood pressure is dropping rapidly. We need to adjust the anesthesia immediately." Dr. Harrington's eyes narrowed. "Nurse Jenkins, I've been doing this procedure for 20 years. I don't need your input." Maya didn't flinch. "And I've been monitoring vitals in this OR for 7 years. Look at the monitor yourself, Doctor. This isn't standard fluctuation." The tension in the room was suffocating as other staff members averted their eyes, unwilling to witness yet another confrontation between the hospital's most renowned surgeon and the nurse he seemed determined to break. But Maya thought of the patient, a 16-year-old boy whose parents waited anxiously outside and refused to back down. "Fine," Dr. Harrington snapped, motioning to the anesthesiologist. "Reduce the dosage. Let's see if Nurse Jenkins's intuition is worth interrupting my procedure." Within minutes, the patient's vitals stabilized. No one acknowledged Maya's intervention, but she didn't need validation. The steady beep of the heart monitor was enough. After the successful surgery, Maya stripped off her gloves and mask in the empty hallway, hands shaking now that adrenaline was subsiding. 7 months at St. Mary's Hospital, and nothing had changed. If anything, Dr. Harrington's hostility had only intensified since she'd proven herself competent. Her phone vibrated in her pocket, a text from the nursing director. "My office." Immediately, Maya closed her eyes briefly, gathering her strength. She'd seen this coming since she'd challenged Dr. Harrington publicly. St. Mary's had a long history of protecting its star surgeons, regardless of their behavior. She straightened her scrubs and walked toward what would likely be another reprimand. Or worse, what she couldn't have anticipated was who she'd find waiting in the director's office. Calvin Broadus, better known to the world as Snoop Dogg, lounging in a chair as comfortably as if he were in his own living room rather than a hospital administrative office. "There she is," he said with that unmistakable laid-back drawl rising to his full height. "The nurse who's been making waves around here." Maya Jenkins had never planned on working at St. Mary's. With exceptional recommendations from her previous hospital in Chicago, she could have gone anywhere. But when her mother's Parkinson's worsened, moving back to her hometown seemed the only option, even if it meant joining a hospital notorious for its old guard mentality. "Are you sure about this?" her friend Tasha had asked during their last shift together in Chicago. "That place has a reputation, and you know how it is. Being the first or the only is never easy." Maya had just smiled. "Mom needs me, and maybe St. Mary's needs someone to shake things up a little." Her optimism lasted precisely 3 days. On her first day, she was met with cold politeness from the nursing director, Evelyn Porter, a severe woman in her 50s who emphasized traditional hospital hierarchies during orientation. By day 2, she noticed how she was consistently assigned the most difficult patients with the least support. By day 3, she realized that Dr. Robert Harrington, the hospital's celebrated neurosurgeon, had singled her out for particular scrutiny. "Your previous experience is irrelevant here," he told her after criticizing her patient documentation, though it followed the exact hospital protocol. "At St. Mary's, we have higher standards." What went unspoken but was painfully clear, those standards hadn't been designed with someone like her in mind. Maya was no stranger to discrimination, growing up as one of the few black children in her school. She'd learned early how to navigate spaces not meant for her. During nursing school, she'd endured professors who seemed surprised by her academic excellence and clinical instructors who questioned her capabilities until she proved herself twice over. But St. Mary's was different. The hostility wasn't just from one person. It was institutional, baked into the culture like a disease resistant to treatment. In the break room, conversations stopped when she entered. Patient assignments were mysteriously reshuffled when certain doctors learned she would be the nurse. Comments about her hairstyle or tone were disguised as professional feedback. Her only ally was James Chen, a young resident who had started at St. Mary's around the same time she had. Unlike the other doctors, James valued her observations and treated her as an equal member of the healthcare team. "Don't let them get to you," he told her one night as they sat in the cafeteria, the only two still there, at 2 a.m. after a grueling shift. "Harrington treats everyone terribly, but—" he hesitated. "But he's especially terrible to me," Maya finished for him. "You can say it, James. We both know it's true." James sighed. "The old guard is powerful here, but they can't hold out forever. Things are changing even at St. Mary's." Maya wanted to believe him, but as weeks turned to months with no improvement, her resolve began to falter. Each morning she woke with a knot of dread in her stomach, wondering what fresh humiliation the day would bring. Each night she returned to the apartment she shared with her mother, forced a smile, and pretended everything was fine. Her breaking point came unexpectedly, not during one of Dr. Harrington's public dressings down, but in a moment of relative quiet. She was checking medication orders at the nurses' station when she overheard two senior nurses talking around the corner. "Harrington's right about her. She doesn't fit the St. Mary's image. Too aggressive, too outspoken." Well, we all know. How she got hired. Diversity initiatives. Merit doesn't factor in anymore. Maya stood frozen, order forms clutched in her hand as the women continued, unaware of her presence. The familiar pain washed over her. Not the sharp sting of surprise, but the dull ache of confirmation. This was why qualified nurses who looked like her remained rare in hospitals like St. Mary's, not because they couldn't handle the work, but because they couldn't survive the environment. That night, she sat at her kitchen table long after her mother had gone to bed, updating her resume. Perhaps Tasha had been right. Perhaps St. Mary's was a lost cause, an institution too deeply rooted in its prejudices to change. But as she typed, her mother's words from childhood echoed in her mind. "Running away doesn't change anything. Maya, sometimes you have to stand your ground and make them see you." The next day, fate intervened in the most unexpected form. Calvin Broadus, Snoop Dogg, had been admitted to St. Mary's discreetly, with a private room and minimal staff. Interaction. The official word was he needed a minor procedure, the details kept confidential. By chance, Maya was assigned to his care, a decision she suspected was meant to keep her away from Dr. Harrington's scheduled surgeries that day. "Well, hello there," he greeted her, looking up from his phone as she entered to check his vitals. "Finally a face that doesn't look like it's been soaked in vinegar." Maya couldn't help but smile. "We aim for a neutral pH balance at St. Mary's, Mr. Broadus." He laughed, a warm, genuine sound. "Call me Snoop, and you are—" "Maya Jenkins. I'll be your nurse today." What was scheduled as a routine check became a 20-minute conversation. Snoop was curious about her, asking questions about her training, how long she'd been at St. Mary's, whether she enjoyed her work. 7 months, she answered, adjusting his IV. "And the work itself? I love it. Always have." Snoop's eyes, sharp and observant despite his relaxed demeanor, caught something in her voice. "But not the place, huh?" Maya maintained her professional smile. "Every hospital has its challenges." He nodded slowly. "And I'm guessing some of those challenges around here have more to do with who you are than what you do." The directness of his observation startled her. For months she'd navigated carefully around the unspoken, never explicitly naming the discrimination she faced, always giving colleagues the benefit of doubting their intentions rather than their actions. "It's complicated," she finally said. "Always is," Snoop agreed, "but from where I'm sitting seems like a waste of talent to have someone like you walking on eggshells instead of doing what you clearly know how to do." The simple validation from a stranger, no less, nearly undid her. Maya busied herself checking the monitors, blinking back unexpected tears. Over the next 2 days, Snoop became an unlikely confidant. During her checks, he'd ask about her day, listening attentively as she gradually shared more about the hospital's culture, Dr. Harrington's hostility, and her growing sense of isolation. "You know what your problem is?" he said on the second evening as she changed his bandage. "You're playing their game by their rules, and their rules were designed so people like you can't win. What's the alternative? Quit?" Snoop shook his head. "Nah, change the game. People like Harrington, they expect you to either conform or leave. What they don't expect is for you to fight back, not with their weapons, but with your own." "And what weapons would those be?" Maya asked, genuinely curious. "Your competence, your compassion, and something they don't have, perspective." Snoop adjusted himself on the pillows. "You see things differently because you have to. Use that. And remember, you're not just fighting for yourself." The conversation stayed with Maya long after her shift ended. For the first time in months, she felt a spark rekindling, not just anger at injustice, but the determination that had driven her into nursing in the first place, the belief that she could make a difference. She didn't know that Snoop had been watching more than just her work. From his private room, he'd observed the hospital dynamics with the keen eye of someone who had navigated hostile territories his entire life. He'd seen how Dr. Harrington spoke to Maya compared to other nurses, noticed the subtle exclusion in the break room, caught the dismissive glances from certain administrators. And Calvin Broadus had never been one to witness injustice and remain silent. Now, sitting in Nursing Director Porter's office with Snoop unexpectedly present, Maya fought to maintain her professional composure. Director Porter looked as confused as Maya felt. "Mr. Broadus requested this meeting," Porter explained, her typically stern voice tinged with unusual deference. "He wanted to speak with you directly." Snoop leaned forward, all traces of his laid-back persona replaced with focused intensity. "I've been watching how things work around here, Maya, and I've got to say I don't like what I see." Director Porter cleared her throat. "Mr. Broadus, I assure you that St. Mary's provides the highest standard of care. For some patients, maybe," Snoop interrupted, "but that's not what I'm talking about. I'm talking about how you treat your staff, specifically Nurse Jenkins. Here?" Maya's heart raced. This was precisely the kind of attention she'd been trying to avoid, the kind that would mark her as even more of an outsider, a troublemaker. "It's really not necessary," she began, but Snoop held up a hand. "It is necessary, because what's happening to you happens to too many talented people in too many places, and it stops talent from rising, care from improving, and patients from getting what they need." He turned to Director Porter. "And that's why I wanted to talk about my foundation's upcoming donation to St. Mary's." Porter's eyes widened. This was clearly news to her. "Donation? My foundation supports healthcare initiatives focused on underserved communities," Snoop explained. "St. Mary's serves an increasingly diverse population, but from what I've seen, your staff doesn't reflect that diversity. And the few diverse staff you do have," he nodded toward Maya, "they're not exactly thriving." The room fell silent as Director Porter processed his words. Maya sat perfectly still, caught between disbelief and a growing sense of vindication. "What exactly are you suggesting, Mr. Broadus?" Porter finally asked. "I'm suggesting that my foundation's very generous donation, the kind that could fund that new pediatric wing you've been planning, comes with conditions. First, a comprehensive review of your hiring and promotion practices. Second, mandatory cultural competency training for all staff, especially your doctors." His gaze hardened. "And third, the establishment of a Chief Diversity Officer position with actual authority to implement changes." Director Porter's face had gone pale. "These are significant institutional changes, Mr. Broadus. I would need to consult with the board." "Of course," Snoop agreed smoothly. "And while you're consulting, I'll be having some interesting conversations with local media about my experiences here. I'm sure they'd be fascinated by what I've observed." The implied threat hung in the air. St. Mary's reputation and its funding depended on maintaining its image as a premier healthcare institution. Negative publicity, especially from someone with Snoop's influence, would be devastating. "I'll speak with the board immediately," Porter conceded, her voice tight. Snoop smiled, settling back in his chair. "Excellent. And one more thing. I think Nurse Jenkins here would be the perfect candidate for that Chief Diversity Officer position. After all, she's already intimately familiar with the issues that need addressing. Maya's head snapped up. "Mr. Broadus, I appreciate what you're trying to do, but I'm a nurse. My place is with patients." "And it still will be," he assured her. "But you'll also be in a position to ensure that every nurse and doctor can do their jobs without fighting the kind of battles you've been fighting. Think about it. You'd be creating an environment where the next Maya Jenkins can focus on saving lives instead of proving she belongs." The meeting concluded shortly after, with Director Porter promising updates within the week. As they walked out, Maya pulled Snoop aside in the hallway. "Why are you doing this?" she asked quietly. "You barely know me." Snoop's expression softened. "I know enough, and I've been where you are, the only one in rooms not built for people like us. The difference is, I reached a position where I could change those rooms." He placed a hand on her shoulder. "Now you can do the same." The months that followed were a whirlwind of change at St. Mary's Hospital. True to his word, Snoop's foundation pledged a substantial donation, contingent on institutional reforms that the board, facing potential publicity nightmares, reluctantly approved. Maya found herself in a new role, Chief Diversity Officer, with a direct reporting line to the hospital CEO. The position came with challenges she hadn't anticipated. Some staff members viewed her as a threat to the status quo. Others expected overnight transformation of entrenched problems. Dr. Harrington and his allies were openly dismissive, referring to her appointment as political correctness gone mad. But she also found unexpected allies. James Chen joined her diversity committee without hesitation. Several nurses who had previously kept their distance now shared their own experiences of marginalization. Even Dr. Edwards, a senior surgeon close to retirement, offered his support. "I've watched this place resist change for 40 years, he told her after a particularly contentious staff meeting. "It's about time someone shook things up." Maya implemented changes systematically, first revamping the hiring process to reduce bias, then introducing regular training sessions on cultural competency and implicit bias, finally establishing a mentorship program for underrepresented staff members. Each initiative met resistance, but with the backing of Snoop's foundation and the increasingly supportive hospital CEO, she pressed forward. The most difficult confrontation came 3 months into her new role, when Dr. Harrington stormed into her office after learning that all surgeons would be required to complete the new cultural competency training. "This is a waste of valuable time," he fumed. "I'm a surgeon, not a social worker. My job is to save lives, not worry about hurting someone's feelings." Maya met his gaze steadily. "With all due respect, Dr. Harrington, your job is to provide the best possible care to all patients, and research clearly shows that unconscious bias affects treatment decisions and patient outcomes." "This is ridiculous. I treat all patients exactly the same." "Do you?" Maya asked quietly. "Because you certainly don't treat all staff the same. And if you can't recognize your biases toward colleagues, how can you be sure they're not affecting your patient care?" Harrington's face flushed with anger. "You're out of line, Nurse Jenkins." "It's Chief Diversity Officer Jenkins now," she corrected him calmly. "And I'm exactly where I need to be." She handed him the training schedule. "Your session is next Tuesday at 9 a.m. Attendance is mandatory for continued surgical privileges." He left without another word, slamming the door behind him. Maya released a shaky breath, knowing she'd just escalated a conflict that had been brewing for months. But for the first time, the confrontation had happened on her terms, in her space, with institutional authority behind her. That evening, she called Snoop to update him on the hospital's progress, a regular check-in that had evolved into a friendship neither had expected. "Harrington's going to fight you every step of the way," Snoop warned, after hearing about the confrontation. "I know," Maya sighed, "but he's not the whole hospital. Things are changing, slowly but surely. Change is always slower than we want, and faster than the resistance can handle," Snoop replied. "Just remember why you're doing this, Maya. It's not about winning against Harrington. It's about creating space for everyone who comes after you." 6 months after her promotion, Maya stood at the podium in the hospital auditorium, surveying the crowd gathered for the unveiling of St. Mary's new diversity initiative. The staff was seated according to department, nursing in one section, physicians in another, administration off to the side. What struck her most was how different the room looked from when she'd first arrived at the hospital. There were new faces, more diverse, bringing different perspectives and experiences to St. Mary's. But more importantly, there was a different energy in the room. Where once there had been rigid hierarchy and silent tension, now there was engaged discussion and collaboration. Not perfect by any means, change never came without resistance, but tangibly improved. Dr. Harrington sat in the back row, his expression neutral. He had completed the required training, though his participation had been minimal. Yet even he had shown small signs of change, most notably in his interaction with James Chen, whose research proposal he had recently supported. As Maya began her presentation, she caught sight of a familiar figure slipping in through the side door. Snoop, who had returned to St. Mary's for the occasion. He gave her a subtle nod of encouragement. A year ago, I came to St. Mary's as a nurse, excited to be part of this institution's commitment to excellence in patient care, Maya began. What I found was a hospital living in two different realities, one where excellence was possible for some, and another where barriers prevented too many talented individuals from contributing their full potential. She paused, looking around the room, meeting the eyes of colleagues who had become allies and those who still regarded her with skepticism. Today, we're not erasing those two realities. We're acknowledging them openly, because naming a problem is the first step towards solving it. The initiatives we're launching today, expanded recruitment in underserved communities, a structured mentorship program, and comprehensive bias training, aren't about replacing excellence with diversity. They're about recognizing that true excellence isn't possible without diversity of thought, experience, and perspective. From the back of the room, she saw Dr. Harrington shift in his seat, not converted perhaps, but listening, possibly for the first time. This work isn't easy and it isn't finished, Maya continued, but it's necessary for our staff, for our patients, and for the future of healthcare. At St. Mary's, we're not just treating symptoms anymore, we're addressing root causes. After the presentation, as staff members mingled during the reception, Snoop made his way to Maya's side. "You did it," he said simply. Maya smiled, watching as James Chen engaged in animated conversation with a new nurse, while across the room, Director Porter, initially resistant but gradually won over, was introducing a recently hired physician to board members. "We're just getting started," she replied. "But yes, something has shifted." She turned to face him fully. "I never properly thanked you, not just for the donation, but for seeing what was happening when no one else would acknowledge it, for believing I could do something about it." Snoop shook his head. "I just created an opportunity. You're the one who stepped up and used it." He nodded toward the diverse crowd of healthcare professionals. "This is your legacy now." As if on cue, Dr. Harrington approached them, his expression inscrutable. "Dr. Harrington," Maya greeted him professionally. He cleared his throat. "Jenkins, your presentation was thorough." Coming from him, it was practically effusive praise. He hesitated, then added, "The mentorship program might actually have merit. I've been considering taking on additional residents." It wasn't an apology or even an acknowledgement of past behavior, but it was a small crack in the wall of resistance, an opening where previously there had been none. "The program would benefit from your expertise," Maya said carefully. "I'd be happy to discuss how you might get involved." After Harrington walked away, Snoop chuckled. "Man's got a long way to go." "We all do," Maya replied, "but at least now we're moving in the right direction." Later that evening, Maya visited her mother, bringing dinner and news of the day's events. Her mother listened proudly as Maya described the initiatives launched and the changes already visible at St. Mary's. "When you were a little girl, you used to say you wanted to help people when they were hurting," her mother recalled, eyes bright with emotion. "I thought you meant as a doctor or a nurse, but what you're doing now, that's healing too. Healing a system that hurts people before they even become patients." Maya thought about her journey, from the nurse who had arrived at St. Mary's full of hope, to the one who had nearly given up in the face of systemic discrimination, to the leader she was becoming. She thought about Snoop's unexpected mentorship and the doors it had opened. Most of all, she thought about the future nurses and doctors who would walk through St. Mary's doors and find an institution striving, however imperfectly, to value them for exactly who they were. "You know what, Mom?" she said, taking her mother's hand. "I think you're right. This is exactly the kind of healing I was meant to do."